Hi, I'm Courtney Smith. I'm a PA and owner of Grand Primary Care, a family medicine clinic in Granville, Michigan. I'm here to answer a question that I get asked a lot in family medicine, which is, do I need a colonoscopy? Let's back up a little bit and talk about why we even care about colonoscopies. Colon cancer is the third leading cause of cancer in men and women, and it's the second leading cause of cancer-related deaths in men and women. And a colonoscopy is the gold standard way to screen for colon cancer. And there are some other methods used to screen for colon cancer, but we'll talk about those later in the video. We'll start by talking about the colonoscopy. After we eat or drink, the food and beverage go down our esophagus into the stomach, then travel down to the small intestine, then to the large intestine, also known as the colon, then through the rectum before exiting the digestive system. When we're talking about colorectal cancer, we're talking about the large intestine or colon and the rectum. A colonoscopy is an outpatient procedure, which means you go to the hospital or the surgical center, have the procedure done, and you go home the same day. You have to fast ahead of time and take a laxative regimen, and this is to really clean out your digestive system so the surgeon can see what they're actually looking for, which is the lining of the digestive system. You're put under light sedation, and then the surgeon uses a scope with a camera to advance it to the areas that they're trying to look at. They can take pictures of any areas that they want to monitor over time. Sometimes they even tattoo certain areas to keep a close eye on them. And this is the reason why colonoscopy is the gold standard method of screening for colon cancer. It's because the surgeon can get that direct view. And if they encounter any polyps, which are small growths, they can remove them right then and there. Some of the polyps turn out to be benign, and that's great. But unfortunately, sometimes those polyps do turn out to be cancerous or precancerous. They just haven't caused any symptoms yet. And that's the whole reason why we do the screening tests. Just last year, I sent a patient for his first screening colonoscopy, and it found that he had colon cancer. And unfortunately, it had already metastasized or spread a little bit to another organ. He had no idea it was there. But because of the colonoscopy, he was able to get diagnosed very quickly. He got the treatment he needed, and he's alive today with a great prognosis. One of the cool things about a colonoscopy is that if you have a completely normal scope, you're good for 10 years. You don't need to go back for a colonoscopy for another 10 years. That's a really long time. What if we had a mammogram that could cover us for 10 years? That's amazing. And if the surgeon does find something that they want to keep a little bit of a closer eye on, for example, a suspicious looking polyp, or if there are multiple polyps, they might recommend that you come back in 3 to 5 years. Let's keep in mind that a colonoscopy might not be right for everyone. Some people are unable to go under the sedation that's necessary for the scope. Some people can't tolerate the PrEP, which is that laxative regimen. And some people have a hard time finding transportation to and from the procedure. And there are some potential complications that can happen after a colonoscopy. For example, perforation, which is when a hole is created in the colon. This is a rare but very serious potential complication. Perforations can be fatal. I mentioned this because complications from colonoscopy are rare, but it's still important for patients to understand risks and benefits when you're going under a procedure. There are alternatives to colonoscopy, and I'll talk about some of the most common methods that I use in my practice. Let's talk about the Cologuard test. A Cologuard test is a stool test that looks for DNA markers of colon cancer as well as microscopic amounts of blood in the stool. This is a test that's ordered by your primary care provider. It's shipped to your house. The kit contains instructions for how to collect a stool sample, and then you package it back up and mail it back to the testing facility. Yes, this is a legit test, and I have ordered it many, many times for patients who are not getting colonoscopies. A Cologuard test could be an option for someone who is of average risk for colon cancer. It really wouldn't be right for someone who is carrying a genetic syndrome that increases the risk for colon cancer, or if we already know that someone has a high-risk polyp, Cologuard would not be a good way to monitor that. If you get a negative result on the Cologuard test, you don't need to be screened again for 3 years. But if the Cologuard test comes back positive, your provider is likely going to recommend that you proceed with a colonoscopy as the next step to rule out colon cancer as the cause for that positive test. Some other options for screening for colon cancer are the FIT test and the Fecal Occult blood test. These are also stool-based tests, and they look for microscopic amounts of blood. Keep in mind that blood is a suspicious finding in the stool, but blood is not always present because of a cancer. Blood can be present for benign reasons. For example, if someone has a hemorrhoid or if they had an upset stomach and might have had some loose stools or diarrhea. Upset stomach can irritate the lining of the colon and cause some shedding of microscopic amounts of blood. It takes a very small amount of blood to result in a positive test. So these types of tests need to be repeated yearly in order to maintain an adequate screening regimen. Some convenient parts of these tests are that sometimes they can be performed in your doctor's office, although sometimes a test kit is sent home with patients to take home to complete and then return either to the office or to the lab. So if you have a negative test, it does need to be repeated yearly. And if you have a positive test, then your provider is likely going to recommend that you proceed with a colonoscopy. You can start to see a pattern here. All roads lead to the colonoscopy. So you could just cut to the chase and start with the colonoscopy as your screening method of choice. But if a colonoscopy just is not the right option, please do choose another method of screening, because some form of screening is much better than no screening. And if you're not quite sure what to do about it, please talk to your primary care provider or surgeon about your options. I want to quickly mention that there are some other methods of screening that are just less common than the ones that I mentioned. And that's the flexible sigmoidoscopy and the CT colonography. Based on someone's overall health and risk factors, a surgeon might decide to proceed with one of those methods instead of a colonoscopy. Now, when do we start screening for colon cancer? The United States Preventive Services Task Force just updated their recommendations in 2021, and now it's recommended to start screening for colon cancer at age 45. We used to start screening at age 50, but as the American College of Gastroenterology puts it, 45 is the new 50. Unfortunately, we were finding more cases of colon cancer in younger people, which is really what led to lowering the starting age for screening. There are theories about why that is, why we're seeing more cases of colon cancer in younger people, but right now that's an area that still requires quite a bit of research. The U.S. Preventive Services Task Force says that if you're between age 45 to 75, you should be screened for colon cancer. If you're age 75 through 85 and you're in good health and you want to continue screening, then it probably is reasonable to continue to do that. But that's an individual decision made between someone and their provider. And there are some reasons why someone might need to be screened for colon cancer earlier than 45. For example, you have a first-degree family member that had colon cancer, or if there's a genetic syndrome that runs in the family, increasing risk for colon cancer. And your primary care provider is the best person to help you sort through that. So if you were wondering if you need to have a colonoscopy, I hope this helps. I hope you feel better equipped to have a conversation with your primary care provider about colon cancer screening. And if you're in the Granville, Jenison, Wyoming, Walker, Allendale, Greater Grand Rapids area, and you need a new primary care provider, I would love to be your PCP. See the notes below for how to schedule an appointment at Grand Primary Care. Follow us on Facebook, and please subscribe to the YouTube channel for more family medicine information. Thanks.